you talk about coming for 5 years, being here for 19. And I think that's the sign of a remarkably strong organization that looks after their people and one another when you have such long-standing service people involved in the organization.
It's actually one of the things that sets us apart, I think, in the healthcare industry is the staff that we have and their commitment not only to the organization but to the community. Because our staff are actually caring for people that are their next door neighbors or their people from within their own community.
Or relatives in some cases.
And that makes a huge difference.
Sure.
It makes a difference in terms of the quality of care that's provided, but it also has an impact on the people who are providing that care because it gives them an extra benefit, feeling that they're actually making a difference in somebody's life that they know and care about.
Yeah, yeah, and I've been to, we just, to expand on that long service award, I've been to three or four, and it's really touching. There's a great amount of people response to that, and the cafeteria is just jammed, and there's some nice gifts that are provided to people, and it's really, really touching. It's a great, it's too bad that a lot more of the town can't be a part of that and see it, but it's a nice way to do things.
We recognize not only people who have been with the organization a long period of time, but we also recognize people who are really outstanding performers.
Sure.
And we've got a vision about exceptional people committed to providing exceptional care. And we recognize our exceptional people, those people that really stand out as providing that exceptional care. We like to recognize those on an annual basis as well as part of that event.
Perfect, perfect. So a kind of a segue into that, what is the new stuff that's going on at the Ross that you'd like to talk about?
Sure. I think there's a couple of significant changes or initiatives that we've got underway. Of course, we're always looking to expand and improve our services, and the next services that are on the horizon, we hope, are MRI, magnetic resonance imaging, that is, and also chemotherapy services that we believe is a real need in our community, and we'd like to be able to provide that need.
Right.
So those are a couple of proposals that we have with government, and we're really pushing to try to get those things in place. And we're also, though, really putting an emphasis on quality and patient safety. And we've done a lot of work at all levels in the organization in the last 2 years to up the bar in terms of our quality of service and the safety for our patients.
Right.
That certainly is a trend across the industry, but we really, I would say, are leaders in that area. Our board, used to be a board that would talk a lot about finances, and now that shift has occurred such that we really focus now on not so much finances, but really what are the indicators of quality? How are we doing with quality? How are we ensuring that we're providing a safe environment for our patients? That focus goes from the board right down throughout the whole organization, and we're implementing a whole variety of projects. One example is something called a medical emergency team, and we're one of the first hospitals in the province to be implementing this. So what is it? A medical emergency team. If you were a nurse on a floor and you noticed a deterioration of the patient, but it's not really a significant deterioration, maybe it's minor. What research shows is that actually if you can catch that deterioration early, you can actually do something about it and reverse it.
Great.
If you leave it too long, it becomes irreversible.
Right.
So we now have a MET team, 1-800-MET. The nurse can pick up the phone and call the MET team. It's a team of critical care nurses and patient care staff who can come alongside of that nurse, evaluate what the situation is, determine what needs to be done, and just to make sure that we're catching those early deteriorations at an early point so that we can correct them. So that's just one example of one of the many projects that we have that we're working on to try to improve the care that we provide.
Good. And